Imagine a delivery man who is rushing against time with some very crucial package to be delivered across different locations, while dodging and maneuvering through the busy streets. Blood is designed to carry essential nutrients and oxygen to various parts of the body in precisely this manner. Now imagine poor blood circulation as little troublemakers, cunning and stealthy, putting obstacles in his way as they lurk in the shadows. The delivery man runs into obstacles at every bend in the road. Can he overcome all obstacles and deliver the packages on time, or will these warning indicators of poor circulation prove to be too much to overcome? Get ready as we reveal the subtle warning signs of poor blood flow that you should be aware of. Your body receives blood, oxygen, and nourishment from your circulatory system. It becomes more difficult for your body to distribute blood to every area of your body efficiently when there are impediments or narrow pathways. Poor circulation may be caused by blood clots, plaque accumulation, or constricted blood vessels. Understanding how your body is affected by poor blood circulation and the significance of recognizing the early warning signs of this serious medical condition will help you take timely action to treat it. Here are the top 12 indicators of poor blood circulation you might encounter. Number 1 on the list is muscle cramping and joint pain. Having poor circulation can lead to pain in the hands, arms, legs, and feet. Additionally, improper blood circulation prevents nutrients and oxygen from reaching tissues efficiently, which can lead to cramping and stiffness. Walking exacerbates leg cramps, which are typically caused by a shortage of oxygen-rich blood in the body. Usually you feel it in your calf, but it can also ache in your butt or thigh. One possible cause of poor circulation could be claudication, a condition in which plaque accumulates along the walls of your arteries, narrowing them. Number 2, varicose vein. This occurs when blood swells veins due to malfunctioning valves. Purplish-blue spider-like lines appear on your skin as a result, usually on the legs. Excessive standing or sitting can make the issue worse. Although the symptoms are usually not severe, they can include tightness, dry skin, aching, swelling, cramping in the muscles, itching, and a heavy feeling in the legs. If you're unhappy with the way your veins look, your doctor can suggest alternative treatments in addition to compression stockings. Next is swelling and edema. Edema, or swelling in the feet, ankles, or legs, may be a sign of inadequate blood flow. Noticeable swelling can result from fluid buildup in the lower extremities when blood finds it difficult to return to the heart. Long periods of standing or sitting can make this condition worse. In most cases, edema is not a major concern. If it doesn't go away on its own, diuretics, also known as water pills, can help get rid of it. Assist your physician in identifying and treating the underlying cause, such as kidney, liver, or heart disease. Number 4. You might also experience cold hands and feet. Symptoms of circulation issues include cold hands and feet. If you feel them against the temperature of your body's trunk, particularly in your fingers and toes, you may find that they are cold to the touch. Reduced blood flow to the extremities could result from this. The body can prioritize supplying blood to essential organs when blood flow to the extremities is impaired, resulting in numb and cold hands and feet. While wearing an additional pair of socks or gloves may help you feel better, the underlying cause of your discomfort will not be addressed. This might indicate the need for a checkup. Coming in at number 5 is tingling feeling in the hands and feet. You've probably felt pins and needles or tingling or prickling if you've ever sat on your hand or rested on your arm for an extended period. You might have even had the impression that your hand or arm wasn't a part of you. This occurred as a result of your excessive pressure on these body parts, which stopped the blood flow. These unpleasant sensations may be caused by nerves not receiving enough oxygen when blood flow is restricted. If, on the other hand, you feel tingly for no apparent reason, like when you're sitting normally, you may also have poor circulation. Attacks caused by a condition known as Raynaud's phenomenon restrict the flow of blood. These areas turn numb and tingle until blood begins to flow again. I trust you found value in our video so far. Kindly subscribe to our channel and give this video a thumbs up. Now moving on to number 6, cognitive dysfunction. Because the brain needs blood flow to function correctly, decreased blood flow can cause concentration issues as well as short and long-term memory problems. Vascular dementia, for instance, can result from an interruption in the blood and oxygen supply to the brain. Reduced blood flow to the brain causes vascular dementia, which affects approximately 150,000 people in the UK and usually gets worse with time. Concentration issues, trouble making plans, and sluggish thinking are some symptoms. Number 7. Chest pain. We refer to this kind of chest pain as angina. Angina is a type of chest pain brought on by inadequate blood supply to the heart's muscles. The oxygen and nutrients your heart muscles require to function properly will not reach them if your circulation is impaired. Angina is characterized by a heavy, constricted sensation in the chest that can occasionally spread to the arms, neck, jaw, or back. This sensation is frequently compared to cramps. It serves as a warning that your risk of having a heart attack has increased. Number 8. Skin discoloration. The nails, toes, and fingers may get bluish-colored skin due to poor circulation. It's called cyanosis, and it indicates that your body is not getting enough oxygen to certain areas. The skin may look paler than usual when there is not enough arterial blood in the body's tissues. These regions may seem purple if there is blood seeping from the capillaries. The hands, feet, nipples, lips, ears, and nose may all become discolored. Seek medical advice if you notice persistent discoloration and pay attention to any unusual changes in your skin. Number 9. Fatigue and extreme weakness. You may have fatigue if you experience extreme weakness even after little physical activity. One explanation could be that blood flow is slower as a result of poor circulation, which can deplete your energy and cause you to feel tired more quickly. Your muscles may not get enough oxygen and nutrients to perform at their best when blood flow is insufficient, which can result in chronic fatigue. Number 10. Dizziness when standing up. A lack of blood flow to the brain is frequently the cause of dizziness experienced during physical activity or when getting up from a chair or sofa. An insufficient blood flow resulting from a decrease in blood volume could be the cause. Number 11. Slow wound healing. A healthy circulatory system is necessary for wound healing. Your blood delivers oxygen, additional nutrients, and white blood cells to the injured tissue when you are hurt. On the other hand, inadequate blood flow to the injured area can impede the process of healing. The chance of infection and consequences like amputation increases with the length of time it takes for an injury to heal. Ulcers in the legs and feet can result from poor circulation, which can impair the body's healing process. Additionally, blood clots in the leg veins can lead to swelling under the skin and the development of ulcers. That might be a more significant issue that requires antibiotics or other medical attention. Number 12. Erectile dysfunction. The amount of blood filling the penis's chambers can be lessened by long-term, unchecked high blood sugar damage to blood vessels. Impaired blood circulation in men is occasionally associated with erectile dysfunction, ED. An erection can be difficult to get or keep going if there is not enough blood flow to the penis. While there are many potential contributing factors to erectile dysfunction, a thorough treatment plan must address any potential circulatory problems. It may be harder for a man to sustain an erection strong enough for intercourse when there is less blood flow. Men with diabetes are more likely to experience this. Poor circulation can be the result of many different conditions rather than being a condition in and of itself. Obesity, diabetes, heart problems, and arterial problems are the most prevalent causes. It's critical to treat the underlying causes of your poor circulation rather than just the symptoms if you exhibit any of these signs and symptoms. The following are a few natural treatments for impaired blood circulation. Regular exercise. Exercise, especially in the legs and lower body, is an excellent method to rapidly improve blood circulation. Walking is one of the best exercises for poor circulation because it can encourage the growth of new blood vessels in the legs, which will increase blood flow. Drink plenty of water. Aim to consume 11 to 16 glasses of water each day to ensure that the body is sufficiently hydrated and that the blood is flowing correctly. Eating a heart-healthy diet rich in fiber and other nutrients. It's critical to stay away from foods high in trans and saturated fats, added sugars, and excessive salt to support healthy circulation. Rather, concentrate on increasing the amount of whole grains, nuts, oily fish, fruits, and vegetables in your diet. Other healthy lifestyle changes include maintaining a healthy weight, and avoiding or quitting smoking. Maintaining general health and well-being requires being aware of the warning signs of poor blood circulation. Consider making an appointment for a thorough assessment with a medical practitioner if you consistently encounter any of these symptoms. You can greatly enhance your quality of life and lower your risk of complications from poor blood circulation by detecting circulatory problems early and managing them appropriately. While the aforementioned tactics are crucial for cardiovascular health, your physician might advise combining them with prescription drugs. Treating circulatory issues and their underlying causes should always be done according to the doctor's advice. I trust you were enlightened by this video. Kindly like, share, and subscribe to our channel for more informative videos like this. Don't forget to leave us your thoughts in the comment section below. Your sound health is our priority. Thanks for watching and see you in our next video.